This is a commonly asked question. Of the two methods of inguinal hernia repair that are available today, which one is better? We know that the Lichtenstein tensionless open mesh repair is the gold standard by which all other inguinal hernia repairs are compared. But over the last decade or so, the emerging popularity of laparoscopy in general has led to many people recommending a total extraperitoneal mesh repair as the procedure of choice. We still don't know whether the laparoscopic method compares with the Lichtenstein, and if so, to what extent. This study consists of an extensive review of the literature that exists on the subject of comparing Lichtenstein hernioplasty with the total extraperitoneal repair, and the authors did a meta-analysis of all studies up till January 2013, where their extensive search of the literature revealed 500 odd papers that were not acceptable and about 14 papers that met the quality standards for well-done interventional trials. This is pretty much true of all of clinical surgery in that there is an awful lot of data, but most of it is poor quality or unacceptable. Of those papers that were accepted, they were able to recruit about 3,300 patients in all for this analysis. The outcome variables that were looked at were all the usual that would be of concern, and they compared the Lichtenstein against the total extraperitoneal approach, and they found that as far as the operative time was concerned, understandably the Lichtenstein did better. It was shorter and could be done in quicker periods of time. But when you measured the time to return to work, the laparoscopic approach was better, and this has been one of the major factors for recommending the laparoscopic approach. As far as seromas and wound infections were concerned, it didn't matter, both were about the same. Surprisingly, testicular pain was less with the Lichtenstein than with the laparoscopic approach, and there was no difference as far as postoperative chronic neuralgia was concerned, nor was there much of a difference in terms of chronic pain, although the extraperitoneal laparoscopic approach seemed to be a little better. Most importantly was the issue of recurrence on long-term follow-up, that is, follow-up of 3 years or more, and the Lichtenstein definitely emerged as the superior option, and this has been an issue of concern, because this, after all, is the main thing that we're concerned about when we're talking about inguinal hernia repairs, is what is the extent of recurrence. The authors therefore conclude that the laparoscopic approach has some advantages over the Lichtenstein, but the major disadvantage lies in the fact that the recurrence rate is much higher with the laparoscopic approach. When you look at the study, it is a very strong study. It was basically a meta-analysis of a fairly large number of patients, in excess of 3,000. And since all the trials were randomized controlled trials, the comparison in terms of control, randomization, protocols, comparability of groups, and so on was good. So much so, this paper is safe and has to be something that we have to pay attention to when we are discussing this issue.